I'm sure you know of what is happening at Tamale Teaching
Right,
Hospital.
right.
The place is boiling because the doctors there have laid down their tools. They are not working again because of reasons that we will bring you on this channel. On Tuesday, the health minister, Minta Kando, went there together with the deputy roads and highways minister, Suhini. They went to the place to find out for themselves an issue that has been running on social media concerning the death of a 31-year-old man at the facility. But when they went to the facility, they had some engagement with the staff and also the management of the Tamale Teaching Hospital. Fast forward, some decisions were taken by the presidency, though the presidency also says that it's not related to the incident that happened at the Tamale Teaching Hospital. But what we understand today is that the Doctors Association, they have laid down their tools. They are saying that they are not working, making some demands. But let's bring you this report. Let's take you back on what really happened. But joining us live is our Northern Regional Correspondent, Shawana Yusuf, who is currently stationed at the hospital, that is the Tamale Teaching Hospital, to bring us up to speed what is happening at the facility now. Good morning, Shawana. Hello, Shawana. Okay, so we will be joined shortly by our Northern Regional Correspondent. But let's take you back. What happened on Tuesday when the health minister visited the facility?
The minister's visit aimed to gain first-hand insight into the challenges health professionals face in the northern region, beginning with the Tamale Teaching Hospital, the region's main referral facility. Although the hospital has already launched internal investigations into the incident, the minister announced the formation of an independent 3-member committee to thoroughly probe the circumstances surrounding the patient's death.
You are behaving in front of me. So you can imagine how
I'm trying to explain.
You can imagine how
I'm trying to be
I mean, with this attitude even to your superiors, can you imagine how you deal with common people? And that's why that creates the problem. That's what will create the problem.
Speaking to the media, he extended his condolences to the bereaved family.
My surprise visit, coincidentally.
So we'll move straight to the northern region at the Tamale Teaching Hospital and have a conversation with our Northern Regional Correspondent, Shawana Yusuf, who is on the line. Shawana, good morning.
Good morning, Philip.
I can hear you loud and clear. What is the current situation at the facility?
Okay, so members of the Association of Doctors at the Tamale Teaching Hospital declared an industrial action yesterday. So this morning we are at the facility to see what is happening. And it appears that there are patients coming in at the OPD to seek medical attention. They've gone through all the procedures. Their vital signs have been taken. But the point where they are supposed to queue and then get into the consulting rooms is where they are stuck right now. So if you check around, you will notice that most of the videos I sent earlier tells about people coming to seek medical attention and they are stuck in a queue because there are no doctors in the consulting room. So this morning, a lot of patients are in the Tamale Teaching Hospital trying to seek medical attention, but doctors are on strike. They've laid down their tools following what happened some few days ago with the health minister's visit to the facility. So the question is, when are doctors coming?
Well, we will still have Shawana on the line shortly, but she is telling us the situation on the ground. Hello, Shawana, can you hear me? A little technical challenge.
Philip, I can hear you loud and clear.
Okay, so go on with what you were talking about concerning the challenges the patients are facing.
So it has to do with patients being stuck here trying to seek medical attention, but because of the industrial action being declared by the Association of Doctors here at the Tamale Teaching Hospital, they are stuck in a queue. There is no doctor in the consulting room to attend to patients who have come in. I visited the ENT. A lot of people are in a queue trying to get medical attention. There is nobody. I went to the emergency area. There was a woman who was brought in. She could literally barely walk because she has a wound on her foot. And according to her, they've been here for over 4 hours this morning, and they are not granted access because there is no doctor to take care of them. So I saw the son coming to pick the mother to take her to the West Hospital probably to see if they will be able to get medical attention from them. And here at the Tamale Teaching Hospital, there is nothing happening. Doctors are on strike. They won't do anything. But what I picked from an inside source is that management is having a meeting with this association of doctors to see if they will rescind their decision and to also ensure that these patients who are here to seek medical attention don't go home unattended. So something should be done. But as to what happens at the end of the meeting, we are yet to ascertain by close of day.
As you go around and you see the situation, have you tried talking to some of the patients? Are they willing to speak on camera? If yes, we could hear from the horse's own mouth what challenges they will face as a result of not getting the consultation they want for today's session at the facility. We have a little bit of technical challenge, but you're still working around.
Philip, can you hear me?
Yeah, I can hear you.
Yeah, so we attempted talking to a couple of people here. Personally, I spoke to a mother who brought the daughter to see an ENT specialist, and they've been in the queue for, according to her, they've been here around 7 because they wanted to quickly finish and then she can go back to work. But unfortunately, even as we
So we established a better contact with Shawana Yusuf, but that is what is on the ground. Some of the demands that the doctors are making is unqualified apologies from the Minister of Health, Honorable Kwabena Minta-Kando, and the Member of Parliament for Tamale North Constituency, Al-Hassan Suhini.
Hello, Philip, can you hear me?
Okay, so joining us back is Shawana. So you were saying something about what the patients have been telling you.
Yes, so there is another patient who tells me he brought the daughter here because they came to the specialist clinic. They were actually booked to come back today for a surgery. And unfortunately, upon arrival, they are told that the doctors are on strike. So as to what happens to the surgery they were supposed to have today is another concern for them. They are hoping that the doctors will come back. Maybe by midday, they will have some good results coming through. But as it stands, we understand that doctors are not attending to outpatient services. Whoever comes in fresh is not attended to. And this means a lot to healthcare delivery here at the only referral center at the Tamale Teaching Hospital. Another referral case that came from Upper East yesterday, I understand, was actually turned back. And as to which particular facility they were taking to next, we are yet to find out on that because doctors said they were on strike. Apparently, they started a sit-down from yesterday and they weren't taking care of OPD cases yesterday, even as at the time they were having their emergency meeting on this particular matter.
As you monitor events there, maybe I think you should drag 1 or 2 of the patients and let's hear from them, or let's see what they have for us so you can drag them. But meanwhile, like if I were stating, the issue with the doctors is that they're demanding unqualified apologies from the minister, that is Kwabena Minta-Kando, the MP for Tamale North Constituency and Deputy Minister for us, Al-Hassan Suhini, should be rendered to Dr. Valentine or doctors of the Tamale Teaching Hospital as staff of the Accident and Emergency Department. Another thing they're asking is that the management of the hospital should ensure that the following are available in short term for us to work effectively. If that is not done, they are not coming. 1, constant flow of water through the taps for clinical work. Stable electricity supply in the hospital. Constant supply of oxygen. Provision of consumable items such as gloves, cotton, face masks, among other things, syringes, disinfectants, etc. Constant supply of a number of issues or things they are requesting here. 100 continuous vital signs monitoring device for all high dependency units in the hospital. 4 ventilators so that's what brought the issue. The ventilator is what triggered the whole issue and the social media was buzzing as a result of the 31-year-old man who went to the facility, wasn't able to get the ventilator, and eventually passed on.
His life, Philip, it's rather sad. If you ask me, I think two wrongs do not make it right. The fact that the doctors have decided to lay down their tools and not rendering OPD and emergency services to the constituents who have done no wrong. I mean, this is no fault of theirs that this has happened. So I don't know how this issue is going to be resolved. And when we get Shawana back on the line, I was hoping to ask her if, aside from the teaching hospital, if there are other smaller hospitals, say polyclinics and others that the patients can depend on, because for somebody to leave their various homes, coming to the hospital or a healthcare facility, hoping that I'll be attended to. Look, it's a terrible thing when you're unwell. So when you are coming to a healthcare facility hoping that you meet a nurse and a doctor to attend to you and diagnose you and at the end of the day prescribe some medications for you to feel better, and then you get there and there's nobody to attend to you, in that case, what should the patients do? Should they go back home with their illnesses? What should they do?
So it makes it a bigger problem, especially when you do not have the needed items or the equipment to run your day-to-day activity. So part of the ventilator things, they're asking 4 ventilators at the accident and emergency department, 4 ventilators at the intensive care unit, 2 ventilators at the pediatric emergency ward, 2 ventilators at the neonatal intensive care unit, 2 ventilators at the maternal intensive care unit, 2 transport ventilators, 2 transport incubators at the obstetric and gynecology department, and service and repair at 1,000-liter autoclave machines at the CSSD. That in the medium term, the following things must be provided to facilitate the work of the doctors: an MRI scan machine that does not use helium, yes, if I got the word right, a CT scan machine that has an infusion pump, a mammogram or mammography machine, among others. It tells you that they are demanding
there's a
lot
list
of
of things.
And I don't know how soon all these things can be provided before they get back to work.
This is quite a tall list of items that they are demanding
issue.
from.
But we are still going to ensure that we get back to Shawana, and we are going to get to the authorities. The Ghana Medical Association also issued a statement also talking about this. This is what they are demanding. The minority in Parliament, that is the Health Committee, they have also demanded that some sort of respite should be brought to the patients of the hospital, and also the sacking of the CEO, Dr. Adam Atiku, wasn't right. That is what the minority is saying. We understand too that the minority may pass through the place today. But let's bring you what GMA has been saying about this particular issue. Let's bring you the full details of their demand.
The minister's unannounced visit to the Tamale Teaching Hospital came in the wake of mounting public outreach and viral social media reports accusing hospital staff of negligence that allegedly led to a patient's death. What was meant to be a fact-finding mission quickly escalated into a tense exchange between the health minister and the head of the emergency department.
You are behaving in front of me. So you can imagine how
I'm trying to explain.
You can imagine how
I'm trying to be
I mean, with this attitude even to your superior, can you imagine how you deal with common people? And that's why that creates the problem. That's what will create the problem.
Shortly after the visit, the hospital's CEO, Dr. Adam Atiku, was dismissed. Among those reacting is the Doctors Association of Tamale Teaching Hospital. The association condemned what it calls a misrepresentation of the facts. The Ghana Medical Association has also waded in, labeling the dismissal as an abuse of power and a clear violation of due process. They have called for an unqualified apology from the health minister.
We feel and we acknowledge the fact that the minister and the government any government, for that matter, has the power to appoint and dismiss any appointee, for that matter. However, we feel that the due process should be done, especially when most media have reported that the person is being sacked on the back of the negligence and certain issues in the facility. How the consultant was treated was totally uncalled for. There's no such conclusion to be made, that the fact that he's trying to explain, and if you watch the video carefully, the man was calm and tried to explain himself. And then the minister, accompanied by the MP, was then shouting at him, pointing fingers and other things. And I think that is unfair.
As tensions simmer, all eyes are now on the 3-member committee set up by the Ministry of Health to investigate the circumstances surrounding the patient's death and systematic issues at the facility. Meanwhile, President John Dramani Mahama has appointed Dr. Abubakar Bawa Abdullahi, a senior academic at the University of Development Studies, as the new CEO of the Tamale Teaching Hospital.
The minister's visit aimed to gain first-hand insight into the challenges health professionals face in the northern region, beginning with the Tamale Teaching Hospital, the region's main referral facility. Although the hospital has already launched internal investigations into the incident, the minister announced the formation of an independent 3-member committee to thoroughly probe the circumstances surrounding the patient's death.
You are behaving in front of me. So you can imagine how
I'm trying to explain.
You can imagine how
I'm trying to be
I mean, with this attitude even to your superior, can you imagine how you deal with common people? And that's why that creates the problem. That's what will create the problem.
Speaking to the media, he extended his condolences to the bereaved family.
My surprise visit coincidentally met the unfortunate demise of, what's the gentleman's name? Salim. My condolences to the family. I have inquired from the CEO and other health professionals here. We are setting up a 3-member committee. I'm told that the facility has already taken steps to investigate the matter, but unfortunately they cannot investigate themselves. And therefore, I'm taking the matter up.
Health professionals at the facility voiced their frustrations over the inadequate medical equipment critical for both emergency and routine services.
When the people turn up at the various facilities, the relatives, the patient, they see you doing your best. Even if at the end of the day, they lose it, they understand that you have done your best. I'll beg of everybody, all the health professionals in this country.
He also decried the poor maintenance culture plaguing many public institutions, noting that it significantly hampers service delivery across the country. As part of a broader solution, the minister revealed plans to implement a new policy mandating that internally generated funds, IGF, be allocated towards equipment maintenance and infrastructure expansion in health facilities.
There will be a new government policy directive where a special escrow account will be created for all our equipment, so that we will use that particular fund to replace or to maintain our equipment.
So that was the Health Minister, Kwabena Mintakando, who visited the Tamale Teaching Hospital. Join us live is the General Secretary of the Ghana Medical Association, Richard Salome. Hello, sir. Good morning.
Good morning and good morning.
I trust you are doing well.
Because we are managing in the...
You are managing. We understand your members have embarked on a strike. Is it a short period of time or indefinite strike?
Well, if you read the statement that our colleagues at the Tamale Teaching Hospital issued, you would note it's a suspension of their services. They obviously take note of the fact that there may be patients still under care, and so indicated that they will safely attend to those patients on admission until they are safely discharged. So our colleagues have taken this action based on the happenings, which I'm sure you and your listeners are aware of. And beyond just the thing happening, it has led to tilting public sentiment against them for issues that have gone beyond even their purview. Now, this has led to various threats being issued. Those of you who are listening to various stations in Tamale, etc., have heard commentaries, people threatening to do all sorts of things to them. Beyond that, too, the doctor in the center has been bullied online and all sorts of things are being said. Knowing the fact that some of our colleagues have been beaten in the past, sometimes for reasons that they can't control, like the fact that there's no bed to admit a patient, when it is not the job of the doctor to expand the hospital or provide the beds. Our colleagues thought it wise that it is important that whilst they are not safe, they don't feel safe because the happenings have exposed them to all sorts of threats, to remove themselves from harm's way. And hopefully, when the authorities listen to their demands, and one of it, which we don't think is too difficult to do, is to just call some truce and apologize for how, especially, the head of department was treated, which have given cause to especially most of the juniors in there asking themselves if their boss, a very hard-working person, dedicated, using his resources to assist, even procuring water, as you may have heard in the video, is treated this way, how much more they who are even juniors and what will be their future. And so it is important that we put that discussion into perspective, and that is why they have decided to suspend their services. And again, the doctors there, like doctors everywhere, have been improvising for a long time for the failings of the system, and probably why the authorities probably do not, should I say, prioritize the retooling of facilities, provision of the necessary logistics, etc. And we've heard the public aspects of the public calling for the fact that doctors don't even, should I say, strike or call for these things. Well, now the doctors are demanding that give us the right tools so that we'll work. We will not improvise and give the care that we do our best to give. And then the same people who receive the care turn around and tell you that you don't even know what you are doing and attack you, etc. So I think the public should actually support the fact that there's a need to be tooling these facilities and providing some of these equipment they are demanding for, and support this cause. After all, the doctors will not take these equipment and things home. They will use it for their care. And if all these things are provided, I believe Tamale teaching hospitals should actually be very well resourced to take care of majority of the cases without even referring them to bring much comfort to the patients who access this facility.
But Doc, the things you've tabled asking for looks like they are many, or they are lots. Are you saying that all these things should be provided before your members will resume work?
The statement first is to prioritize that public engagement that at least signals to the public that it is not as though the doctors are the cause of all the problems there are, and then also diffuses that notion that there was negligence, which is a prejudgment of an issue that is yet to even be discussed or looked into or investigated. And the doctors say once that is done, they will resume some of the services whilst waiting for these things to be procured. Of course, we are reasonable people. If there's a clear commitment shown that the instruments are going to be procured, why not? We will sit at the table if they reach out, and then we can begin to discuss with our colleagues and then see what way we can get them back to work to serve the people and continue doing the great service that they render.
Right, Doc,
So,
this morning. Okay, go ahead. Please finish up.
yes. So I think we've heard also that the Select Committee of Parliament on Health is in the area and has decided to step in to understand the issues that are on the ground and interact with our colleagues. We were monitoring that to note what assurances they will give. We respect dialogue and constructive ones as such, and we will engage. We believe our people will engage. We are monitoring that and hearing feedback, and that will guide our next steps as to what to do or not do. Yes.
All right, Doc, so I was going to ask that this morning our colleague, who is a Northern Regional Correspondent, was at the hospital, and per her reports, she mentioned that patients are at the hospital being unattended to. And I wanted to ask you, since the doctors have decided to lay down their tools, what should the patients do in the interim? Should they just go home?
Well, my sister, we announced this, and unfortunate as it is, alternatives have to be found for this whilst we engage and solve the problems. You know, you have to live to let live. And the health, welfare, safety of these same doctors we are calling to go and provide the services, who are already overworked and under various stresses, is also important. We have had colleagues break down, suffer mental health conditions, depression, because sometimes patients die right in front of them when they know they have the skills. It's just that they lack the right equipment or things, or sometimes delays in even securing ambulance, etc. And so it takes a big toll on the practitioner. It's not as if we are immune to stresses of life, of work, and the things that go with. And as I've mentioned, people have been beaten, slapped at that emergency for things that have nothing to do with them. And so we expect the patients who are there and not being seen to be advocates, to call on the authorities to do the right things. Tone down, get to the table so that we all sit. GMA is committed to supporting government to achieve its goals in the health sector. We have actually taken upon ourselves to raise funds and even share theater tables and phototherapy machines, incubators to deprived communities to support various governments over the years. And so we are not antagonistic to the targets government wants to achieve, and we are willing to sit and support. It's just that the modalities and the way it is done must be done in a way that engenders committed health workers who are already sacrificing to even do more and continue to serve. So we believe the public should become our advocates, because what we are demanding actually is to serve them.
Doc, before you go, because you'll be moving into a meeting shortly, what is your final word to the government? Because often we've seen strike upon strike, we come and have an engagement with the individuals or the people embarking on the strike. Nothing is done, you come back to work. But what is this engagement, or what is the call you make on government immediately that must be done before you resume work?
So let me correct that impression when you say strike upon strike. I don't even remember the last time GMA has.
I'm not referring to only GMA. I'm referring to other bodies as well, not only GMA.
I speak for GMA, so I need to clarify that. That we probably haven't even been on strike since 2015, if I'm not mistaken. And not because we didn't have situations, but we sought to handle situations well, and we want to proceed as such in constructive engagement with government to support whichever government is in power to achieve its goals. And so what we expect is that the authorities should engage. We will sit with them, dialogue, and chart a path to improve the conditions in the health facility. It is not only Tamale Teaching Hospital. If you go to other teaching hospitals and other hospitals, I'm sure some of your stations have done various documentaries in the challenges to the various hospitals which lack modern equipment, broken down equipment, no beds, poor emergency response systems across board, which was even demonstrated live on TV during the last State of Nations address, even in Parliament. And so we are willing to work we were willing to engage. We expect that the authorities come for us to all find some middle ground to work with and chart a path. We believe that once they show commitment to providing some of these key equipment and logistics, and also address that public perception that has been created, which has led to various risks and threatened attacks and etc. of cyberbullying on the colleagues that practice there. We definitely can all find a way forward on this matter and find an amicable solution. Yes.
Honorable, thank you so much for your time, Doc. Dr. Richard Solomon is the General Secretary of the Ghana Medical Association, and he has told us details of what the demands of the doctors are. When that question was posed to him by GIFA, that what should the patients do, he says, well, some sort of alternative should be found. That means they are very much serious about the situation. Our Northern Regional Correspondent, Shawana Yusuf, is still joining us. Shawana, what is the current situation? We understand that you've been asked to move from where you were to a new place. Share with us what has transpired so far.
Okay, so the situation is still the same. Patients are still trooping in to see if they will get medical care. I think what the problem is that management is trying to contain the whole thing. Hence, they don't want the media to be talking about it and having things flow out and all that it is. So as it stands, most patients who have not heard about the strike action here at the Tamale Teaching Hospital are still trooping in. Though it is a referral center, people come in with their personal problems and knowing very well that they have all the specialists here at the hospital. So we have a lot of people queuing, hoping that they will be able to see their doctor before they go home. But as at the time I visited the consulting rooms, I think I opened about 3 of them. They were empty. There was nobody inside the consulting room, not even a nurse was there. So, I mean, they are still hoping that there will be a doctor to come around in the course of the day to attend to them with their health problems.
Again, what is the pressing issue with the Tamale Teaching Hospital? Paint us a picture of how the facility is and what really the challenge is when patients come there.
Okay, so the Tamale Teaching Hospital is one of the biggest hospitals we have here in the northern region. I mean, the whole of the three regions of the north is the biggest. The only teaching hospital for that matter. It serves all the other 4 regions of the north, including the neighboring countries, Burkina Faso and other places. This place, during the Mahama administration, when they did the phase 2 of the hospital project, I mean, we had a lot of facelifts to the facility. A lot of specialist units and other things were added to the facility, and that actually made it a go-to place for everybody who had an issue of concern so far as health is concerned. But the challenge is this, Philip. The issue of water is one thing you can't take away when you're talking about the Tamale Teaching Hospital. It happens to be in the Tamale South constituency. This area is an area that I hear it doesn't have very good water bed. So even if you drill a borehole, it is not something you will succeed. And it is one of the areas that water company has difficulties in pumping water to. Because I hear they are in a hilly area or so. So when they pump the water, because we don't even have enough at the production end, they are not even able to pump the little that they have. Even when they ration, they are not able to give them enough and all that. So the teaching hospital, when it comes to water, is a major thing. I did a story, I think last year, talking about patients having to use buckets to go and outside and buy water to come and take care of their patients. That's patient relative going outside to buy buckets of water to come and take care of their patients when it comes to bathing and washing of their clothes and all that. Besides the issue of water in healthcare delivery, you know how what it means when a doctor and a nurse should get in contact with a patient. They need to ensure they do thorough hand washing, and if there is no water, you can understand what that means. What it means is that we kind of come and take the diseases from here and take it back to our homes, and on the daily, that is what happened. Even when the minister visited, their attempt to see the washrooms that the patients are using was not successful, because when they entered there, the stench alone made them step back again. And I'm not going to blame anybody for this. I think something is not working. I don't want to mention names here, but I feel something needs to be done. If there is no water in the facility, what is the way forward? What are we doing next? Who is not doing what? There should be some kind of cleaning going on the daily. You don't get up and go to a public washroom and the place is a mess. But we don't also expect the workers here, i.e. the doctors and nurses, to use their personal resources to buy water to take care of those problems. Okay? So, I mean, these are some of the challenges, especially when it comes to water in this facility. When we move away from water, during the minister's visit, we also got to understand that there were a lot of essential medical equipment that are broken down. They haven't been fixed. Most of them have been ordered brand new, but we don't have the agency that actually brought this particular equipment to the facility to come down to train the users, the end users of this particular equipment, how to use them. And this doesn't seem to be something they know already how to operate. They are different, they are improved versions of what they have, hence they will need some training. So you go to the ICU, there are ventilators there, about 8 of them, that are not being used. They are not being used just because they don't know how to operate them. And when they switch on one of them, they produce some loud noise. That shouldn't have been the situation. So besides that, the MRI is not working, CT scan is not working, the SSD, CSSD department, most of their equipment there are not also working for sterilization. So when it comes to the Tamale Teaching Hospital, the problems are enormous. And this is what the Association of Doctors are calling for. They say besides having to apologize to their colleague doctor, they are calling for the Ministry of Health to ensure that these particular equipments are brought back to the facility or are made available so that they can also give off their best. They are doing their best, but it looks like their best is not enough because of the lapses we have in the facility. So this is a picture of what the situation is here at the Tamale Teaching Hospital.
Wow.
You've mentioned a number of things. She has mentioned a number of things. And you mentioned water. But what of when you enter the facility proper, do they have the items that the doctors have mentioned? Ventilators, equipment needed, syringes, gloves, and all that. Some of the doctors or the nurses, when you've been there for some time, filing report on the Tamale Teaching Hospital, how were they going about running of the hospital without these things?
Philip, I can attest that there are even instances where patients' relatives are made to buy some of this.
So that's Shawana Yusuf there, Northern Regional Correspondent, bringing us all the details we need to know about this issue. But before we engage her again, the Select Committee in Parliament on Health will be going to the place. Joining us is the Member of Parliament for Ebuakwa South constituency and member of the Select Committee, Dr. Kingsley Ajiman. Hello, Honorable. Good morning. Good morning, Honorable. Hello?
Hello, good morning.
I trust you are doing well.
Sure.
Yesterday, the minority issued a statement on the dismissal or the sacking of the Chief Executive Officer of the Tamale Teaching Hospital, Dr. Atiku Adam. What was the minority's point in this? Let's start from there before we go on the grounds, what the doctors are demanding for.
So thank you very much, and a very good morning to your viewers or listeners globally. We are talking from Tamale. The minority is here to assess and meet. But in our statement, we made it very clear that the enabling or the Establishment Act of the Ghana Health Centers and Teaching Hospitals Act It does not give any authority or power to the minister to do to announce what he said he has done. He is not clothed with that authority, and that authority resides in the president in consultation with the Council of State. So we are saying that it is null, it is void, it's of no effect. Secondly, the unfortunate verbal exchange abuse in a hospital facility with the minister involved was really, really, really out of order. I mean, that is the lowest that can happen in the public sector, where a sector minister has an open confrontation in a hospital facility where patients are receiving health care. It is very, very, very low, because the office of the minister calls for a high degree of sobriety. You can't just express at worst what could have happened in conclave. But you took the minister, took the media to the facility, and now brought the facility to the media. He was not even minded that he had carried the media to the facility.
Honorable, won't the argument also be that the minister was very much frustrated about the situation, i.e. the death of the 31-year-old man, and the fact that the facility proper didn't have a better washroom, or whatever demand they are making now should have been taken to the higher hierarchy so that it will be addressed immediately?
Philip, that is where he even got it worse wrong. Frustrated, therefore it should cause more frustration. Frustrations call for soberness, especially if you're in the high office of a minister. What are we talking about? So let's play this analogy: parent-children relationship. If your children are doing things that are not right, and you think you can chastise them in a way that will make them worse off, the misbehavior brings about an output that is commendable. So what we are saying is that it is not a good thing to rise to the level of a minister. When you yourself was a ranking member of the health committee, and you think being a minister for 3 months, you can change things within a twinkle of an eye. He is very much aware of the happenings in our public health facility.
Okay.
And we are not saying that the death of that person, and we even tell the minister that the hospital was under a duty to disclose the circumstances that led to the death of the young person. It is only the court or a security agency or a security agency close with an investigating authority. And this asking for this information couldn't have happened in conclave. We are saying that his behavior went overboard. There was an abuse.
So for now, what is your side demanding for?
We made it clear in our statement. We called for an apology and also called for the reinstatement of the CEO. But we knew, knowing our brothers from the other side, we knew, so we're not surprised. Well, yesterday evening, they appointed a new CEO. I mean, for them, due process doesn't matter, and termination is something that is in their DNA. So, in effect, what they are telling the people of the North, because the Tamale Teaching Hospital is the only teaching hospital that serves the Northern Enclave. Today, by the action of a minister who did not exercise decorum, the whole teaching hospital is on strike. Who is going to suffer? It is the people of the Northern region. So the minority, we are here today to plead with them that when the two elephants fight, it is the grass that suffers. We plead with them. The people of the North deserve better. They should look beyond. They should look beyond the attitude of the minister and serve their people. So it's an appeal that will be making to the management of the teaching hospital this morning.
From the individuals who are, that is the doctors who are on strike there, they have tabled a number of things they demand. But before we get into that, the Deputy Roads and Highways Minister, Suhini, who went with the Health Minister, has stated that whatever happened there is not a reason why the chief executive officer for the Tamale Hospital, that is Dr. Adam Atiku, was sacked. So why is the minority making a statement that may have accounted to it?
So I was on the same platform as my respected colleague, and the minister in a sack announcement said that it was not only attributable to. But what we are saying is that the provisions of the Act 525, that establishes teaching hospitals and the Ghana Health Services, it says there is a president who has the right to do so in consultation with the Council of States, which we know there has not been any table and there has not been any meeting of the Council of States that the president consulted their views. That has not happened. So they are seriously administrative breaches, and it is extremely unfair. We are not saying you don't have the power to sack. The power to sack lies in the bottom of the president in consultation with the Council of State. And that has not happened. That has not happened. The law that establishes teaching hospitals and Ghana Health Services is very clear on disciplinary procedures. They should show us. Yesterday, when I was on the same platform, my respected friend, the MP for Tamale, he said it could be coincidence. And we're quick to say that the coincidence is so much of a coincidence. Because absolutely preposterous to think that a decision was taken in Accra to sack the CEO. The minister flew on the taxpayers to Tamale, came to Tamale, went back to Accra before the announcement would be made. I know my good friend, Honorable Felix Pacho, said that's no joke with his work. Are they telling us that the decision, because Felix is the government spokesperson, the decision has been taken by the president, and Felix could not announce, and had to wait for the minister to come to Tamale, come back to Accra before the minister himself announced the tax? Please, give us a break. These are absurd, and it's not in order. But we are pleading. We are pleading with the doctors here that they should look beyond the paging and do what they always do for the people of the North and anybody that comes in contact with their service. Our colleague, the minister, too, I believe is at legislature and equal to soberness. Honorable Senior Akando, you know what you did to us when you were the ranking. We do not want to mess up the same thing to you, because I can say on authority, based on precedent, if any of us was a minister who had come to exhibit the kind of behavior here in Tamale, and if Honorable Akando then had come to Tamale today, as we are in Tamale now, the judgment of listeners and viewers, they can go ahead. There would have been something else. All that we are saying is that soberness, sobriety. Public service is a thankless service, and once you put your foot out there for it, you should be ready for it. We pray for kindness. We pray that the people of the North, the Tamale Teaching Hospital doctors, we pray they listen to us so that they resume their services, so that caregiving, happens here in the North.
But as you are praying that they should resume services, they are also making demands, things that will help them do the work. Honorable, they've tabled a number of things. I'm sure you have seen them. In the interim, what should be done so they can also have the needed tools to work with? We don't want to blame any political party that maybe your government stayed in power for 8 years, what you did for the Tamale Teaching Hospital and what this government is going to do. But what do you suggest should be done immediately so they can go about their day-to-day activities or work effectively and efficiently?
What you have really said is not all, and it runs to all public health facilities. Allocation of resources is a preserve, or it is a duty of the executive. Knowing what they have now known, I believe that they have to do well. But if you make reference to the Abuja Declaration, that suggested that member states should spend about 15% of their annual budget in health. And when I had opportunity to debate on the health budget in Parliament, I made it very clear that the provisions made in the budget concerning health was very, very abysmal, and the allocation was too low. We made just about 9% of the national budget, to the extent that I jokingly referred to the health provisions of the 2025 budget as an Aboboya budget. We are very much guided. So I was very much guided by saying this. Because you see, you can't play politics of our health. The health of the nation is its wealth. On the floor of Parliament, this is not an attempt to self-legalize myself. But you see, on the health of the nation, and the NDC minded by this in their manifesto, chapter 5, they developed 8 thematic areas, out of which they seized out 33 health intervention propositions for proposal. But just about 2 fully found expression in the national budget. 4 was partially present, representing just about 18% of their total intervention in the 2025 budget. As for our health, we can't joke with it. We can't play politics with it. Because, no humility, touch me. When the thing was so high, when temperatures had risen so high at the hospital, touch wood, if my colleague had experienced a medical emergency, who was going to take care of him? Is it not the same people he was fighting with? So we have to move on. And again, let me further state that health financing is about time we change the narrative. Health financing cannot solely be done by government. We call on people who are well situated in society to make donations. Johns Hopkins, Rockefeller, and others. These are private people who contributed massively to their healthcare systems. Let's all help. Let's all help.
Well,
our health facilities are not the best. The whole health system is challenged. We are capping their IGF, which when they appeared before the committee, they are discussing with the finance minister to see how we can uncap their IGF. There are a lot of workers that they need. You go to a whole facility and there's no bioengineer, biometric engineer. You don't have these engineers, you don't have these essential workers in the hospital, so the equipment will be there to develop a force, and it is left idle. Water supply is a big challenge, electricity, utilities. The hospitals are paying just like any commercial entity. If there could be a discussion around the Minister for Energy where maybe the hospitals or public hospitals are giving some form of subsidy, it will go a very long way to help all of us. So it's a multi-sectorial approach that we must have towards our health, and that all of us have a role to play. Let me tangentially, or put it this way, had it not been this issue, how many times that health promotion even find expression in our media team?
We don't have a role to play. We will be prioritizing it in the coming days. But before you go, have you engaged the doctors yet? What have they been telling you, and what have you been telling them as well? Briefly on that.
But personally, we have engaged a lot of doctors. Most of them have called ever since our statement came, and their frustration is no different from what the doctors
I'm asking now that the select committee is at the Tamale Teaching Hospital now.
We are engaging them this morning.
Okay.
We are yet to.
Okay. So we'll be getting back to you on what they will tell you, the select committee. Thank you so much, Honorable. That is the Member of Parliament for Ibuakwa South constituency, and also a member on the Parliament Select Committee on Health, Dr. Kingsley Ajibadifa. This is the situation. Tamale Teaching Hospital is in that situation. But this is one of the lots.
Yeah.
Kolebu, same. Maybe Greater Accra Regional Hospital, Ridge, same. Maybe 37 Military Hospital,
same.
Konfanoche. We saw the Otunfo soliciting for funds to renovate the
Konfanoche Hospital. But
big problem in the health
Philip,
space.
I like one thing the minister said, the fact that he said they are going to engage the doctors to entreat them to go back to serve the people of Tamale, because it's by no fault of theirs that this has happened. But again, Shawana also mentioned that there are some equipment in the hospital that the health workers can't even operate. These equipments have been acquired for so many years, as I suppose, and they can't operate it, so it's just lying down and not doing anything. Why are we doing this to ourselves?
You buy things, you don't even train people to even operate it. So why do you keep them inside? And my problem even is that sometimes the same politicians, the same people in the higher space in this country, when they have health conditions, they
fly away, yeah.
And you fly to UK, you fly to US, you fly to Germany, you fly to wherever country you want to go to seek healthcare. You forget that it's our money that we are using to give you to fly. And you fly and you don't even take care of this hospital facility we have. I've always been saying it on this show that the privileged thing that we have it all, so we don't want to think about the people down there. But mind
these are the people we are serving.
Exactly.
You promised to serve.
The money we are giving you in forms of taxes is because we want something changed. Why will you even come and tax us more and we really want to pay? Because we know that the money we give you don't do it for anything. You don't use it for anything. So probably you're not using the money to do anything. We wouldn't pay more. Tamale Teaching Hospital, the problem didn't start today. It started way back. And it's increased and it's getting worse by the day. Maybe another case will happen in another facility and we'll go there and the doctors will also come out with a lot of challenges. When it gets to your desk and you don't do anything and you go to the facility and maybe mind my language, you go there shouting or not, it doesn't solve the problem. What the problem is on the ground is that we want the needed equipment to get the work done. And also when they give them the equipment, learn how to use it. You don't put equipment somewhere and it will be collecting dust and you come out and you say that you can't use it. What's the meaning of this?
Anyway,
it's just annoying.
We take a quick break here. When we come back, there's more on Breakfast Daily. Do stay with us. We'll be right back.